Have you ever heard of hyperparathyroidism? It's a condition that affects the small but powerful parathyroid glands, which play a crucial role in regulating calcium levels in the body. When these glands become overactive, it can lead to a range of symptoms, from fatigue and muscle weakness to kidney stones and bone loss. In this video, we're going to explore what hyperparathyroidism is, the different types, how it's diagnosed, and the treatment options available. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Before we dive into hyperparathyroidism, let's first talk about what the parathyroid glands actually do. Despite their name, these glands are not related to the thyroid gland. The parathyroid glands are 4 small glands located behind the thyroid in the neck, and their primary function is to regulate calcium levels in the blood. They do this by producing parathyroid hormone, or PTH, which helps control how much calcium is released from the bones, absorbed from the food, and excreted by the kidneys. Calcium is critical for many bodily functions, including bone strength, nerve function, and muscle contraction. When calcium levels drop, the parathyroid glands release more PTH to raise calcium levels. When calcium levels are too high, PTH production decreases. But in hyperparathyroidism, this balance is disrupted. Hyperparathyroidism occurs when one or more of the parathyroid glands become overactive and produce too much PTH. This leads to excessive calcium being released into the blood, a condition known as hypercalcemia. Elevated calcium levels can affect multiple organ systems, causing a variety of symptoms. There are 2 main types of hyperparathyroidism, primary and secondary. There is also a less common form known as tertiary hyperparathyroidism. Primary hyperparathyroidism occurs when the parathyroid glands themselves become abnormal, leading to excessive PTH production. The most common cause is a benign tumor called a parathyroid adenoma. This is a non-cancerous growth that develops in one of the glands and increases hormone production. In some cases, multiple adenomas or an enlargement of all 4 glands, known as parathyroid hyperplasia, can be the cause. Less commonly, primary hyperparathyroidism may be caused by parathyroid cancer, but this is rare. Primary hyperparathyroidism is more common in women, particularly after menopause, and in individuals with a history of radiation exposure to the neck or certain genetic conditions that affect the parathyroid glands. Now, secondary hyperparathyroidism is different because it results from another condition that lowers calcium levels in the body. When calcium levels drop, the parathyroid glands work harder to compensate by producing more PTH. Common causes of secondary hyperparathyroidism include chronic kidney disease and vitamin D deficiency. In kidney disease, the kidneys lose the ability to regulate calcium and phosphorus properly, leading to low calcium levels and overstimulation of the parathyroid glands. Similarly, vitamin D is essential for calcium absorption, so a deficiency can lead to increased PTH production. Unlike primary hyperparathyroidism, where calcium levels are high, secondary hyperparathyroidism is usually associated with low or normal calcium levels. Finally, tertiary hyperparathyroidism occurs when secondary hyperparathyroidism persists for a long time, usually in people with chronic kidney disease who have been on dialysis. Over time, the parathyroid glands become permanently overactive and continue producing high levels of PTH, even when the underlying cause has been corrected. In this case, calcium levels may become elevated, similar to primary hyperparathyroidism. The symptoms of hyperparathyroidism can vary depending on the severity of the condition. Some people, particularly those with mild primary hyperparathyroidism, may not experience any noticeable symptoms. However, as calcium levels rise, symptoms can develop and affect multiple organ systems. Common symptoms include fatigue, weakness, and difficulty concentrating. Many people describe a general feeling of being unwell or brain fog. Hyperparathyroidism can also cause mood changes, depression, and irritability. Since calcium plays a key role in muscle and nerve function, muscle weakness and joint pain are common complaints. High calcium levels can also affect the digestive system, leading to nausea, vomiting, constipation, and loss of appetite. One of the most well-known complications of hyperparathyroidism is kidney stones. When excess calcium is filtered through the kidneys, it can form crystals that develop into painful kidney stones. Long-term effects of untreated hyperparathyroidism can include osteoporosis, a condition where bones become weak and brittle due to excessive calcium loss. In severe cases, high calcium levels can cause kidney damage, abnormal heart rhythms, and pancreatitis. If hyperparathyroidism is suspected, blood tests are the first step in diagnosis. Doctors check calcium and PTH levels. In primary hyperparathyroidism, both calcium and PTH are elevated, confirming the diagnosis. In secondary hyperparathyroidism, PTH is high, but calcium levels are usually low or normal. Other tests may include checking vitamin D levels and kidney function to identify potential underlying causes. To assess the impact of the condition on the body, additional tests may be ordered, including bone density scans to check for osteoporosis and imaging studies such as ultrasound, CT scans, or sestamibi scans to locate abnormal parathyroid glands before surgery. Treatment for hyperparathyroidism depends on the type and severity of the condition, as well as the presence of symptoms and complications. For mild primary hyperparathyroidism, especially in people without significant symptoms, a watch and wait approach may be recommended. Regular monitoring of calcium levels, kidney function, and bone density can help track the condition over time. In some cases, lifestyle changes such as staying well hydrated, avoiding excessive calcium intake, and getting enough vitamin D can also help manage mild symptoms. However, surgery is the only definitive treatment for primary hyperparathyroidism. Parathyroidectomy, the surgical removal of overactive gland or glands, is highly effective and often cures the condition. The procedure is typically done using minimally invasive techniques, which have a high success rate. Surgery is usually recommended for people with significant symptoms, very high calcium levels, kidney stones, osteoporosis, or kidney dysfunction. For secondary hyperparathyroidism, treatment focuses on addressing the underlying cause. In patients with kidney disease, phosphate binders, vitamin D supplements, and medications like calcium mimetics may be used to help regulate PTH levels. If the condition progresses to tertiary hyperparathyroidism, surgery may be needed to remove overactive glands. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any questions or topics you want covered in future videos. Anyway, the outlook for hyperparathyroidism depends on the type and severity of the condition. Many people with mild primary hyperparathyroidism can live without major complications, while those who undergo surgery often experience a full recovery. Managing secondary hyperparathyroidism requires ongoing treatment, particularly in those with chronic kidney disease. While there is no guaranteed way to prevent hyperparathyroidism, maintaining good bone health with adequate calcium and vitamin D intake, staying hydrated, and managing underlying health conditions can help reduce the risk of complications. So, hyperparathyroidism is a complex condition that can significantly affect calcium balance in the body. Whether it's due to an overactive gland in primary hyperparathyroidism, a response to low calcium in secondary hyperparathyroidism, or long-term kidney disease in tertiary hyperparathyroidism, understanding the condition is key to getting the right treatment. If you've been diagnosed with hyperparathyroidism or have symptoms like fatigue, kidney stones, or bone pain, talk to your doctor about your options. Early diagnosis and appropriate management can prevent complications and improve quality of life. Thank you for watching. As always, take care of yourself and make the most of your day.